The journey with Ekam is now for over a decade.
We have two main verticals in our work. One is the healthcare and the other is the education.
We began with only surgeries. We began with only going to hospitals, go to the communities first, meet the patients there, and then get them to the hospitals.
There is a very significant segment that is not able to access that, and the gap is affordability.
We have a crowd of a very low socioeconomic patients. Ekam Foundation has been helping for the transplant patients. Regarding cancer patients also, they had been helping for medicines and invasive.
मेरी फैमिली कंडीशन इतनी ठीक नहीं थी, ख़राब थी, तो फिर मेरी पढ़ाई इतनी अच्छे से नहीं हो रही थी.
Mainly all students are from the underprivileged background.
We decided that from a preventive healthcare perspective, let us develop a school health awareness program that allows children to train in health and hygiene habits. So we are talking of dental habits, we are talking of toilet etiquette, we are talking of hand washing, we are talking of nutrition. So that child-centric approach that comes throughout the organization becomes the main tenet of the organization.
मुझे एप्लास्टिक एनीमिया हुआ था.
मुझे प्रॉब्लम था, पैसे का बहुत प्रॉब्लम था.
डॉक्टर ने वापस से बोला कि नहीं, इसका आपको बोन मैरो ट्रांसप्लांट ही करना पड़ेगा.
वो टीचर से हम लोग बोले थे ऐसा ऐसा हमारा प्रॉब्लम है करके.
उसके बाद में इसको फाइब्रोइड की गांठ का प्रॉब्लम था, वो भी 4 बार हो गया.
फिर हमने बोन मैरो ट्रांसप्लांट के लिए किया तो उन्होंने हमें 15 लाख का बताया.
फिर वो लोग क्या बोले, वो फाउंडेशन एकम फाउंडेशन से मिलेगा, आपको हेल्प मिलेगा.
एकम फाउंडेशन का हमें बताया.
एकम फाउंडेशन के आके मुझे पैसा मिलने के बाद मैंने वहाँ से डिस्चार्ज ले लिया.
तो एकम फाउंडेशन ऐसे मुझे तब से हेल्प करना चालू हुआ.
We are requested for help from all over in different parts of the country.
Ekam Foundation has supported us in many ways, not only our school but our students also.
Once Ekam Foundation came to the forefront and helped us, we have been able to save these children and give them a long lease of life.
एकम फाउंडेशन स्कूल में आते हैं और अपना अभिनव स्कूल में वो पूरा विजिट करते, बच्चे लोग से बात करते और उनके फॅमिलीज में भी जाके बात करते.
त्यांची पूर्ण माहिती घेतली जाते, सखोल तपास केला जातो, खरंच ते गरजू आहेत का, खरंच ते टॅलेंटेड आहेत का, हे सगळं बघितलं जातं आणि त्याच्यानंतर एकम फाउंडेशन त्यांना त्यांच्या फीसाठी मदत करते.
The scholarship is mainly on the academics. Then we have a round of interviews and then we also look at, when we can't decide between two, we also look at their backgrounds.
We have doctors, we have engineers, we have people from the finance and management background, we have teachers. So all of them together bring in a lot of strength to the organization, and that puts Ekam at a different level.
Transparent goal, plan of action, result tracking, उनके पास एक clear vision है कि आपको क्या प्रॉब्लम है और उसका सॉल्यूशन क्या देना है.
They are absolutely transparent in their functioning with all their CSR related registrations in place, and because it is already CSR registered, all the documentation utilizations are done wonderfully well.
We also have a very strong ethos of giving back. So many of our senior students who are in colleges will volunteer with us.
When these beneficiaries, as we call them, go out into the world, it's a ripple effect that we create, that they become our brand ambassadors and they take our vision forward, what we have in mind for Ekam.
Our impact assessment program, that's why is very highly driven by going back to the child and saying, where are you in your life right now? How can we help you next?
फर्स्ट ऐसा फाउंडेशन मैंने मेरे करियर में, मतलब लास्ट 10 इयर्स में एक फाउंडेशन ऐसा है कि बच्चे लोग को कंटिन्यूअस पे कर रहे. जैसे वो बच्चे 7 में थे, फिर 8, 9, 10 आगे भी कर रहे. मुझे वो ये इतना अच्छा लग रहा है कि वो बच्चे स्कूल छोड़ के गए, फिर भी एकम फाउंडेशन उनका स्टडीज़ के लिए कंटिन्यू हेल्प कर रहे.
When do you donate? You donate when you find that your money is deployed properly.
Donors come with different requirements. One donor may be happy by paying for a child surgery. The other donor may want to give a classroom. The other donor may want to give an equipment. So there are multiple needs of donors, and there are multiple needs on the side of the school and the hospital, and we try to match it.
The whole idea about the needy children getting access to affordable health and affordable education, access to basic needs for them to really shine, is something that really draws me to Ekam.
Donors look for that reliability and accountability from NGOs, and we've been able to give them that, in terms of giving them a very concrete framework for implementation, as well as an outcome assessment and kind of a monitoring system that has given them the reason to believe in us or in our work.
You want to be sure that where you're investing, where you're donating, you hope that it is going for the right cause.
A very large portion of my contribution is finally going to the beneficiary, and it's not getting used in the large OPEX teams and all of that.
We make a living with what we get, but we make a life with what we give.
जो हैप्पीनेस आपको दूसरों को खुशी देकर आती है, वो अपनी खुशी से भी बढ़कर होती है.
You can see it's making impact next door. You can see it making impact in a street.
Children sitting in Agartala, a school sitting in Garhwal, a patient in Vellore, they all are being supported by us.
We have covered 20 states in the whole country.
In that sense, I find Ekam is very rooted in India's reality.
I would only encourage people to not hesitate, because once you are on the other side and you take that first step, you find that things move, it's easy, it's not so difficult, and you will feel the extent of release of joy and satisfaction that it gives you, something that you probably have never experienced. I would strongly, out of my personal experience, recommend you to take that first step.